Am I a candidate? Really, most people are a candidate for rhinoplasty. Social media has really triggered people taking photos and doing critical self-analysis of what they look like, especially in profile. And as people look at themselves in profiles, they notice little bumps in their nose, they notice that their nose doesn't project as well as it should, and that's really been what has triggered a lot of people looking into rhinoplasty. Most people are a candidate for a rhinoplasty. There's very few things that will exclude somebody from being able to have an actual procedure done. Pretty much everybody is a candidate for it. It's really just assessing what it is that we're treating and where we want somebody to actually be. The most common reason that we do it is for breathing. Form equals function in rhinoplasty. It's very, very true. If something looks proportional, if something looks how it's anatomically supposed to, it's going to function how it's anatomically supposed to. Sometimes there's medical reasons why people can't breathe well. Sometimes we have to manage allergies. But from a purely structural standpoint, by treating somebody with a rhinoplasty, my main goal is making it so that it is in the form that it's supposed to be so that it can function how it can. When will I look normal is probably the most common question that I get. I would say that the majority of rhinoplasty surgery or rhinoplasty recovery happens within the first 2 weeks. So I always tell people after 2 weeks, you're going to be able to go out in public. You shouldn't really have any bruising at that point. A big part of your swelling is going to be gone by the 2-week mark. Most people by the 2 weeks are back doing everything that they were before. No more discomfort or things like that. Most discomfort is within the first 5 days after having a rhinoplasty. We often will put packs on the inside part of the nose. Those packs have to come out somewhere between 48 to 72 hours after the rhinoplasty. It's like taking off a Band-Aid. We also take off a cast at the same time that we take out the splints, and that's when you'll really start to see a good portion of the outcome from your rhinoplasty when the cast comes off. You'll still have a little bit of swelling, but by the about 3-month mark, you're 85–90% where you're supposed to be. About 10% of patients are a candidate for a revision, and about 1% of patients actually do it. Revision is anything from clipping the end of a suture that comes out months later to doing very subtle reshaping several months after the rhinoplasty.